Hello, welcome to Greenbelt Career Institute CNA program. We'll start with Chapter 1. If you can open to Chapter 1, the Nursing Assistant in Long-Term Care. Open to Chapter 1, Section 2, where it says in red, describe healthcare settings. So we'll always start with Section 2 of each chapter. The Section 1 has a lot of definitions that are also repeated again throughout the rest of the chapter from 2 to the end. So we will be bypassing Section 1. So long-term care. Remember that this program, the Maryland Nursing Assistant Program, focuses on nursing assistant in the nursing home. So long-term care means nursing home. Just remember that. So what is long-term care? It's a healthcare setting that provides 24-hour care for people with ongoing conditions who are generally unable to manage their activities of daily living. Somebody gets old, they cannot function at home independently, or do not have family members to help them. So they go to the nursing home to be cared for there. So nursing home also provides skilled care. Skilled care means medically necessary care given by skilled nurses or therapists. So therapists would be like physical therapists, occupational therapists, and speech therapists. Chronic care means long-lasting kind of diagnosis. For example, somebody has diabetes or hypertension. It's long-lasting, but it's stable. It requires maintenance care, not urgent. So that's the kind of care provided in a nursing home. Long-term, chronic or long-lasting kind of treatment. Resident means a person who lives in a nursing home, a person who lives in a long-term care facility. You know that when people go to the hospital, they are called patients, but in the nursing home, we call them residents because they live there. So nursing assistants do very important work, and there are so many different areas that nursing assistant can work. We'll talk about that later. But as we said earlier, long-term care facilities provide 24-hour skilled care, and long-term care facilities assist people with ongoing chronic medical condition. And we said that the long-term care facility is a residence home. So just like you would expect people to treat your home with respect when they come in, you would treat your residence room with respect when you go there to work. So just imagine how you would feel if somebody touched your personal belongings. So be mindful when you go into the residence room to provide care. So other type of healthcare settings that we have here in the United States, assisted living. So assisted living, which is a step below a nursing home. Assisted living is for residents who do not need skilled care. They don't need physical therapy, occupational therapy. They don't need skilled nursing care. They're able to take care of themselves in terms of providing activities of daily living. They just need some supervision. Home health care, just like the name implies, that's care provided at home, in the home of the residents, for those that can afford to stay home and hire nursing assistants or nurses to come and provide care for them in their homes. Adult day services, this is care for people who need some assistance or supervision during the day, during certain hours of the day, but it's not a facility where they sleep over. They go back home to their family at a certain time of the day. They play bingo, kind of like a daycare center for the elderly. Sandwich generation, what that means is people responsible for the care of both their children and their parents. For example, I'm taking care of my elderly parents, and I also have maybe disabled child or a sick child that I'm also taking care of. Intergenerational care means where you have children and their parents being provided for at the same time. For example, in my nursing home, we have a resident who's about 90 years old, and she also have a son in the same nursing home who's about 65 years old, and they're both in there. So you have two generations being cared for at the same time. Acute care, remember we said chronic care meant long-term, long-lasting, well, which is provided in nursing home. Well, acute care is for short-term illnesses, emergency situation. This is provided in the emergency room in the hospitals. So 24-hour skilled care for short-term illnesses or injuries, generally given in a hospital or surgical centers. Subacute care is kind of in between chronic and acute. So for example, you may have, in my facility, we have a section, subacute care section, where if somebody becomes too sick, but not sick enough to go to the emergency room, so we place that resident in the subacute care section, where we have a nurse practitioner, we have nurses taking care of them more closely than the other residents, because now their situation has changed from chronic, but not quite acute yet. Doesn't require the emergency room. When we feel we can take care of them in-house, we kind of, place them in the subacute section. Outpatient care, that's when you go to a doctor and you go back home that same day, or maybe you go to the hospital and go back home the same day, and that means outpatient care. Rehabilitation. You will see a lot of nursing homes have rehabilitation next to their name. For example, you have where I work, it's Deanwood Nursing Home and Rehabilitation Center. That means the nursing home also perform rehabilitation care. So rehabilitation is a program given by specialists, like we mentioned earlier, physical therapists, occupational therapists, and speech therapists, to restore or improve function after an illness or injury. For example, somebody had a stroke and they're paralyzed on one side. So first they go to the hospital for acute care. Once they're stabilized, and they're going to need rehabilitation. So if they qualify, depending on their age, they go to the nursing home to stay there to receive rehabilitation services by physical therapists who will help them try to walk again like they used to walk before. The speech therapists will help them make sure they can swallow well, especially when the stroke will affect their speech. Then the occupational therapists will help them, for example, learn to put on their shirts, tie their shoes, button their shirt, things like that. Hospice care, this is care for people who, for example, they may have terminal cancer, and the doctor has determined that they only have 6 months to live. So in that case, the care will just be comfort care, where all treatments will be stopped, no more expensive testing and treatments, but they will be on pain medication just to keep them free of pain, as they have less than 6 months to live. Animal assisted therapy, this is a practice where people bring dogs and cats to a nursing home, and then some selected residents that are able to participate, they will gather around and then they'll play with the pets, makes them feel good. Medicare and Medicaid. Now, for the purpose of the CNA training program, all you need to know is that Medicare is a federal insurance program for people who are 65 years old or older, or they are disabled, or they have an illness and cannot work. You know, if you when you start working, or some of you that are working now, you will see that there's a Medicare deduction from your paycheck. There's a Social Security deduction. So the Medicare is used to pay for your health insurance when you turn 65, or if you become disabled before that age. Medicaid is a state assistance program, state assistance medical program for people with low income, also for people with disabilities. A lot of people in nursing home, they pay for their stay through a combination of Medicare and Medicaid. Some of them pay privately out of pocket. But you can read through the rest of the Medicare in your textbook. But like I said, for the purpose of the program, you just need to know that Medicare is a federal program and Medicaid is a state program. Length of stay is the number of days a person stays in the facility. For example, when somebody that have stroke, like we said earlier, when they first leave the hospital and get to the nursing home, their length of stay is going to be about 100 days. After the 100 days under rehabilitation, they may go back home if they can function, or they may get converted to long-term care. Dementia, serious loss of mental ability such as thinking, memory, reasoning, and communicating. So we're going to skip through some of this. We already mentioned them. Some of them you just have to read in detail in your textbook. So we have some statistics about the makeup of residents in the nursing home here. So we're going to skip through that. So we mentioned that this program is all about the nursing assistant role in the nursing home, in the long-term care. So who is a nursing assistant? A nursing assistant is a person who performs assigned nursing task, and gives personal care. Well, let's talk about the personal care, which is the next topic there, activities of daily living. So these are all the personal daily care that nursing assistants will be assisting to provide to the resident. So we have bathing, skin care, nail care, hair care, walking the resident, eating and feeding them, giving them drink, providing oral care, dressing them, transferring them, toileting them, and a lot more. So in addition to this, you will be given assigned tasks by your charge nurse or unit manager, such as taking vital signs or doing range of motion, things like that. So you're performing basic tasks of personal care generally on a routine basis, in addition to tasks that will be assigned to you by your charge nurse. So we talk about that. Nursing assistant provides services for residents in two ways. So remember, that will come in your quiz. Assigned task and providing personal care. So when we talk about personal care, these are some of the other activities that nursing assistant perform: serving trays and feeding resident, helping resident dress and undress, bathing, shaving, bed making, tidying the room, vital signs and toileting, mouth care, back rub, and very important, observing and reporting changes in condition and their complaint. Now remember, the nursing assistant work very, very closely with the residents, more than any other professional. So the nursing assistant get to know when the resident is sick, when they are unhappy, when they are sad, when there's a problem, they might be in pain. So because the nursing assistant spend more time with the resident, then the nursing assistant should always observe and report anything new, anything you suspect might be wrong. If they're not feeling fine, just talk to them, ask them what's bothering them, so that you can report it, so that they can get help. So again, the nursing assistant also help residents to move safely by walking them and caring for their supplies. Now, what nursing assistants do not do in a nursing home: nursing assistants do not insert tubes. You don't insert and you don't remove tubes at all. Nursing assistants do not give tube feedings, do not change sterile dressings, and never give medications. Even if you have a CMT, CMT is not valid in a nursing home because you have charge nurses, RNs and LPNs giving medication in nursing home. So CNS do not give medication. Like we were talking earlier about other names or titles that nursing assistants are called, especially when you start looking for a job. You might want to, if you search under nursing assistant, you might search under nurse aide, patient care attendant, health care attendant, patient care technician. The hospitals call their nursing assistants patient care technician. So if you're interested in working in a hospital and you're job searching, you might want to search for patient care technician, certified nursing assistant also. Professionalism. So as a professional who's going to be licensed by the State Board of Nursing, Maryland Board of Nursing, you are expected to be professional at all times. So what does that mean? Be professional. It's an act or behavior that is proper for a certain job. If you're a pastor, there's a professional behavior for a pastor. If you're a politician, there's a professional behavior. Well, even though these days our politicians don't quite behave like public servants like they're supposed to. But you know what I mean. If you're a doctor, if you're a nurse, you behave professionally, and that's generally acceptable way of behaving. What should be expected of you as a professional. So what are some examples of professional behavior as it relates to nursing assistant? Well, let's take a look. You have to be neatly dressed, groomed. Do not discuss personal problems with the residents. Be at work on time. Avoid unnecessary absence or lateness. Never leave your work without permission. That could actually cost you your license. If you abandon your post, the facility might send your name to the Board of Nursing for abandoning a resident, and that could be a problem. Do not report to work drunk or under the influence of alcohol. Always maintain a positive attitude. Remember, you're working with the residents. How they see you has a lot to do with how well they feel. If they're not happy with you, then they're not going to be happy in themselves. So sometimes you're the one that makes a difference in their life. So if you maintain a positive attitude, then it will rub off, and they will also be positive as well. Do not gossip about the residents or gossip about co-workers. That's not professional. Be polite, be respectful. Always address residents how they wish to be addressed. But if you're not sure, always go Miss Susie, Mr. Raymond, Mr. David. Unless they tell you, for example, I might say, "Oh, you can just call me Ray." Then you can call the resident what they wish to be called. Never use curse words, profanity. Keep residents' information confidential. Never gossip or talk about residents' condition. They might have HIV, and you don't go gossip to other staff members about their condition. Follow policy and procedure of your employer. Report problems to your supervisor. If you don't know something, ask questions, and always maintain your continuing education requirements at all times. Be honest and document carefully and honestly. Accept constructive criticism. Sometimes you make a mistake, And if you're being corrected, just accept it in a humble manner, because everybody learn from their mistakes. Do not accept gifts or tips from family members or from the resident. It's improper. It's against the law. The reason is because you're not the only one that provides care in a nursing home. So if a resident's family wanted to appreciate the staff, you can just politely say, oh, we're not allowed to accept gifts directly, but you can give it to the unit manager on behalf of the staff, maybe a box of candy that everybody can share. Be loyal to your facility. That's where you work, and that's who pays your bills. So some people, complain about the work environment every day, but yet they're still there. If you're not happy where you are, just put in a resignation professionally, and then you can move on to another place. Again, when you're not sure about something, go and read the policy manual about what you're supposed to do, or ask the supervisor. Okay. The best nursing assistants have certain traits, so let's look at some other traits nursing assistants should have. Nursing assistants should be trustworthy, conscientious, courteous, empathetic, and accountable. Okay. Accountable means that you're answerable for every action that you take. So nursing assistant should be patient. Already mentioned all of that. So choose one of the qualities that nursing assistant must have. Can you imagine a situation on the job where that quality is needed? Can you describe a time when you used that quality in a previous job or in your personal life? Well, I'll give you an example. Patience. One of the things that you're going to find helpful in this profession is patience. We're dealing with a population that is elderly. Just think about your grandmother or your grandparents, your grandfather. They're going to be slower than before. They're going to take time to eat and chew and swallow. So you have to take your time to be patient and allow them time to take their time and eat comfortably at their own pace. They're not doing it intentionally. It's just, we're all going to be old someday, and we're not going to be moving as fast. We're not going to be performing the task as fast. And you will expect your caregiver to be patient with you. And especially when it comes to feeding, if you rush them, then they don't eat much, and then they start losing weight. So it's important that you allow them time to do everything at their own pace. First impression, what does that mean? That's when you first meet someone or you first go into a place. Most of the time, that first moment they see you, they meet you, that's the memory they're going to keep of you. If you walk into the residence room smiling, guess what? They will always think of you as that smiling Raymond or that smiling David. Or you walk into the room, sad, or you look angry, they might not even want you to provide care to them, because if you look angry and you're supposed to be providing care, then they don't trust you to provide that care in a conscientious, caring manner. So a way of classifying or categorizing someone or something at the first meeting. So making a good first impression is very important, and proper grooming is an essential part of a good first impression. We talked about earlier, keep your uniform neat, bathe and wear deodorant every day. And please wear deodorant. Don't just put on perfume and then, sometimes some people have body odor, and just make sure you put on deodorant. It'll go away. Brush your teeth at least twice a day. Avoid strong scented products. Don't put too much perfume, please. Some residents have asthma or breathing problem. If you walk into the room and you have a very strong scent, that might cause them to have difficulty breathing, so you don't want that to happen. Keep your hair neatly tied back. I know ladies, uh, some ladies like to wear long hair, and when they bend to provide care and the hair is all over their face and the face of the resident, well, that's not good. So, hold your hair back or tie it, don't let it be on your way. For the gentlemen, keep your beards trim. Ladies, apply light makeup, not too much. You know, don't wear artificial nails. You're going to be putting on gloves, so if you have long nails or artificial nails, that's going to affect the glove. Keep your shoe laced and try to put on non-skid shoes so that you don't slip and fall. If you have tattoos, keep your tattoos covered nicely. So like we said earlier, the resident may be allergic to some scents, especially those with breathing problem. Care team. Care team is a group of people in the facility with different kinds of educational background, and they perform specific tasks for the resident. So that's your care team. And we're going to see a list of the care team in the next slide. RN is a registered nurse. This is a nurse who will be in charge of the unit. Charge nurse could be a unit manager, could be a director of nursing, or an assistant director of nursing. LPN is a licensed practical nurse who can also be a charge nurse. They pass medication, give treatments. Diagnosis is when a doctor have determined that you have a chronic or it could be acute problem. You may be diagnosed with hypertension, or you may be diagnosed with eye infection. Assisted device, special equipment that helps a person who is ill or disabled perform activities of daily living. For example, somebody is using a cane to enable them to walk, or somebody is using a wheelchair to enable them to move around. So we talk about the care team. So this is the list I was telling you about. So in a typical nursing home, you're going to have these different professionals providing care for the resident. Now, when we talk about a care team, it always starts with the most important person, who is who? The resident. The resident is the most important care team member, because it's all about the resident. You have the nurses there, the nurse practitioners, the doctors, physical therapists, occupational therapists, speech therapists, the dietitian, the social worker, and the activities director, and of course, the nursing assistant. Now, activities director, what they do is plan activities for each resident, or for a group of residents, or for the unit, or for the building. When residents move into the nursing home, the activities director department will go in to see the resident to find out what kind of activities would they like to do or participate in. Maybe play bingo, play cards, play chess, or whatever they like to do. The social worker's job is to be like a liaison between the family and the resident. So anything that has to do with the courts or family issues, all of those things go through the social worker. Dietitian, of course, is the one to figure out what specific diet is suitable depending on the resident's diagnosis. And we talked earlier about the speech therapists, occupational therapists, and physical therapists. Those three specialists, they work under rehabilitation to help restore function. We said earlier the resident is the most important member of the care team. Chain of command is the line of authority in the facility. For example, in a nursing home, In the nursing department, starting from the top, you have the administrator, then you have the director of nursing, you have the assistant director of nursing. This is going down the chain now. Then you have the supervisors, you have the unit managers, you have the charge nurses, and then you have the nursing assistant. A charge nurse is a nurse who's in charge of a particular team or a particular unit. Could be a registered nurse or it could be a licensed practical nurse. Liability is a legal term that means that you are responsible legally for any harm that you cause while you're doing your work. This chain of command, again, like we said earlier. Delegation. Delegation means transferring authority to a person for a specific task. So your charge nurse could give you authority to perform a certain task or to, take care of other tasks. When it comes to performing a task, always remember that just because the charge nurse asks you or delegates that you perform a task doesn't mean that that's the right task that you should be performing. For example, if a charge nurse asks you to go give medication, you will not give that medication because it is not the right task. You are not trained to give medication. So whatever you've been asked to do has to be the right task, the right circumstances, doing it to the right person, like the right resident, and the right communication or direction is given to you, and there's a supervision of what you're doing. For example, the charge nurse supervises everything that the nursing assistant does. One thing with accepting a task, if you're not sure you can perform that task correctly, you have to respectfully tell the charge nurse or the supervisor that you are not able to perform it yet, if they can show you so that you can learn it. But just make sure you don't keep saying that you don't know how to perform a task over and over, then that will be a problem. Again, ask questions when you're not sure of what to do. Holistic. So holistic means that as you take care of a resident, you are looking at the totality of the resident's need, okay, which includes physical, social, emotional, and spiritual needs. So you walk into a room to feed a resident. Well, feeding is physical, but you find out that the resident is sad or emotional, or they may be crying. Well, you can't just say, well, I'm here to feed you, and start feeding them. No, you're going to put the tray aside and try to find out why they're crying or why they're sad, so that you can get the charge nurse to address the pain, or maybe they get the social worker to talk to them. They may need to see a pastor or something. They may need some prayers. Now, you don't pray for them. It doesn't matter if you're a prayer warrior or you're a pastor in a church. You are never to pray for the resident in the nursing home. If they need prayers, you let the social worker know to contact their home pastor. So we said that the nursing profession always takes a holistic approach, which means you're taking care of everything. Team nursing, a method of providing care in which a nurse act as a leader of a group of caregivers. Team leader, a nurse in charge of a group. Primary nursing, this is the practice in the hospital where the registered nurses are the ones that provide all the care to the residents. Some units in the hospital, they don't use CNAs, so the registered nurse is the one doing everything. Continuity of care means that care is ongoing, round the clock, ongoing coordination of a resident's care over time. Okay, functional nursing, this is a method of care that involves assigning specific tasks to each team member. Person-centered, kind of same thing as holistic, because everything that we're doing is centered around the care and the comfort of the resident. So, talked about policy and procedure. Policy means a course of action to be followed. Procedure means a method of how that course of action will be carried out. We have our policy and procedure here at school. You will have policy and procedure wherever you go to work. Make sure you understand the policy of your workplace and ask questions when you're not sure. Cite is a word from citation. This is when the Department of Health come to the nursing home to do an inspection, which is also called a survey. If they find any problem in the nursing home, then they will issue a citation so that the nursing home can correct that problem. A joint commission is a non-profit organization that evaluates and gives accreditation to nursing homes. So survey procedures involve inspection periodically. Surveyors will come to the facility. In fact, we just recently have surveys in our facility. They were there for a week and a half, and they gave us about 15 citations. They watch you do everything, how you knock on the door, how long it takes to respond to the light. They ask the resident questions if they have any complaints. So they always find something. So it's important that during that period that you're more alert and answer all the lights on time. Nursing assistant should never guess when answering a question by the surveyor. For example, if they ask you, Miss Susie, where is the nearest fire extinguisher? They want to know if you know your fire protocol, the fire policy of the facility. If you're not sure where the fire extinguisher is, just say, I'll be right back, let me get that information for you, and then go find out where the fire extinguisher is, and then come back and let them know, the fire extinguisher is over there. Don't say, well, I don't know. That will not be cool at all. So that's it for chapter 1, and hope you write down questions if you have any concern or you need further explanation about anything that we talked about. You just ask one of your instructors.